You're burning all your material. Okay, so we're waiting for a little message that tells us it's building an audience for us. It takes a couple minutes to get that sometimes, so bear with me.
Where am I going to follow this?
Here we go.
Can you help me?
You're going to the Facebook page,
Go to your
Coffee
Facebook.
on the Dock.
Don't do mine, yeah.
Go into Facebook.
You guys have a Twitter?
No, we do not.
No?
Not for this.
Bring Tom down. I hate this phone.
Hi, gang. We're setting up to share this out to some folks, so bear with us. We'll be getting started in just a minute with our guests. We're at Coffee on the Dock. I'm Greg. Good morning.
I'm Loretta. Good morning.
I'm B. Ramos. Buenos dias.
There we are.
Find us.
Yeah, now we're sharing.
Yep. So you're going to share that out to as many people as you possibly can. I would like somebody to share this to my profile if they have the opportunity out there in Facebook land, because my phone is the camera this morning.
I think I shared it.
Think so? So you should also be able to invite friends, maybe. If you'd like, I'll hold your phone and take a stab at making that happen. When you hit the share button, you usually just a share, or it may say invite friends, and you can invite people specifically, individually, to join the discussion.
Here you go. You can take care of that if you don't mind. Happy Valentine's Day, everybody.
What I'm going to do is I'm also going to... You mind if I hold on to your phone for a few minutes?
No, I don't mind at all. Please, by all means.
It only gives us the share now. That's okay. Because I can't read comments from over here in the air chair. There we go.
You want a bigger phone?
What's that?
You want a bigger phone? I can log in on here.
No, I'm good.
Okay.
Okay, hi everybody. It's me, Greg, from So Local Pasco and from Coffee on the Dock. You may have seen me on such shows as Goals and Gratitude 8 minutes ago. And I do my show, which is So Local Pasco, a live Facebook show about what's happening in our county. We also do a, I'm not sure that microphone thing is plugged in there. Let's see. Yeah, see, that doesn't look, Hey, can you hear me now? Rock the camera if you can hear me out there in Facebook land. It's a highly technically proficient production process we have here. So let's see. Let's see if Corey Cottrell is on it. He's already here this morning. Good morning.
Good morning.
Share now. I'm going to do that again just to make sure. Anyway, I do Coffee on the Dock. I do Goals and Gratitude with Corey. Those are his things, by the way. Part of the Baboon Room Media Group, which now includes my show, So Local Pasco, and the news show. Loretta was a guest on the news show on Friday, and she was there to talk to and encourage us to go out to the town hall meeting that was held by local representative Gus Bilirakis. He seems intent on repealing the ACA, and Loretta's goal was to get enough people out there to show him that that was not a really popular idea, and she succeeded beyond my wildest imaginings. I could not have imagined that it was going to get to the Washington Post and MSNBC and CNN.
Fantastic.
National coverage of our local town hall in Newport Richey, Florida.
It wasn't on Fox News, though. I'm
Funny
not
enough.
sure why.
Funny enough, I can't even
beside
imagine.
myself on that one.
Yeah. Wait, is that sarcasm? I think I smell some sarcasm in the air. So anyway, welcome Loretta and B to our show this morning. B Ramos is also now. You guys want to say? I want you to place yourselves on the show here as guests. So you're just members of our community.
Okay.
We're certainly that. We're certainly concerned citizens of this community, this county, this state, this country, this planet that's in peril. But
Right.
I specifically am a shop steward for the custodial engineers at an HCA facility in Trinity Medical Center.
Great.
Which is a fancy name for I'm leader of the housekeepers, leader of the janitors.
Nice, great. Loretta?
I just want to add a little bit to B. He was unanimously elected by his peers to represent them and to lead them in...
It's a charm offensive is what it is, right?
Yes. No, he's wonderful. He's a phenomenal leader. Again, good morning. My name is Loretta, and I'm a union organizer here in Pasco and Hernando County. I represent 1,000 members between two HCA hospitals. By the end of next year, I think it'll be 7 campuses between the 2 hospitals, and then I also have a nursing home up on State Road 50. And my union is our union is a healthcare union. We represent healthcare workers inside of corporate facilities. And I'm also a resident of Pasco County for over 30 years, and we care very much about this place. It's worth fighting for. So we've we've become, you know, soldiers in arms over here, just trying to fight for what's important to us as residents and citizens, family and neighbors, and we have to look out for each other, and we have to press on to make sure that we're taken care of, and that, you know, that this current legislation doesn't hijack everything that we've fought so diligently to get in place.
Right, right. Well, thank you for joining us this morning. We really
Thank
appreciate
you, sir.
it.
Appreciate it.
You know, Corey wanted to be here. He had another pressing engagement, and this is the thing that we face with just the 2 or 3 of us doing this. Sometimes we have to scramble to make sure we can get everybody on that we want on.
Sure.
But one of the things that hasn't been happening in our community is there hasn't been a really media opportunity for people that represent unions and labor to come and talk.
Right.
Just casually and openly about goals and about life and about why labor unions are important. And I mean, you know, I grew up in the age of union vilification. I grew up in the age when you know, I'm in a right to work state, and you know, unionizing here is a battle. And so it's funny that it's funny to me that it's not funny, ha. It's funny,
Sure,
interesting
sure.
to me that that here we are in a county that has deep economic problems, that has positioned itself, you know, decades ago to take care of the elderly, and then not done all the things necessary to build infrastructure to do that. So we huckstered them down here to buy houses, and we promised them that we would take care of them in their old age.
Right.
And then we didn't educate or train anyone to do those jobs. So
Right.
so people flood from other areas for, you know, for jobs that are skilled positions. But people that grew up here often, you know, don't have educational opportunities to get there. And now we're losing those retirees because we haven't done a good job of helping them, you know, and supporting them. We're losing them to other places now. And it seems to me that what got lost in that was the value of labor. It just seems to me that if we were a union state, we would be having different discussions about what our issues were here. What do you think, Loretta?
We have, I mean, I have to say that I think we have some of the best healthcare providers, and I've been all over this country. I've been fortunate enough that the organization has sent me, you know, California, New York. I've been
So you
everywhere.
disagree with me?
I
That's
do.
fine. That's
I
fine.
do.
Well, and you
Here-
are far more
Thank you.
inside and knowledgeable than I am.
On a certain, you know, on one part of that, I disagree with you, because I think that we have, you know, the best healthcare workers here. People really love what they do, to the extent that our CNAs and our LPNs and our nurses, they provide for our patients, where corporate is cutting back.
Right.
And I'm not going to throw any names out there because I represent a couple corporations. I'm not legally allowed to do that at this moment, but I'll let you know when I get the green light. I'll be back.
In May,
But,
we might have a little more to say.
Okay.
They always cut back on trying to, you know, of course, pad their bottom line. And what they cut back on is briefs, supplies, staffing. So, I mean, I have members that have done laundry for patients. They cry with patients. They bring their own products and toiletries in to care for them. You know, so they
That's
go
an
above and
outrage to
beyond.
me. That's an
You should be
outrage to me.
outraged because it's a crime.
Right.
It's a crime.
So
It's
you're telling me
corporate
that the
welfare.
people that are working in the system are diligent, dedicated, professional people.
Yes.
The system they're working in,
Yes.
not so much.
Can I just paint a little bit of
Please
a
do.
grosser picture for
Because
you?
having been talking to people that are involved in our school system,
I was
that's
about
also
to
their
say,
observation.
precisely.
You know,
I was just
when
about to
our
say.
new education secretary tweeted out where they keep the pencils, and 8,000 teachers tweeted back at her, "You bring your own, because that's what we all do." Knucklehead. You know, how'd you think that was going to go? How tone deaf do you have to be to post
Yeah.
that?
The healthcare
Oh,
system
Lord.
is pretty much right now in the same boat. Not all. Not all. Some of my facilities do a very good job of providing supplies, and some of the other ones not so much. So if you look at what happens is that you have these staff members that come in and they take care of their patients, and corporate's trying to pad their bottom line, so they're pulling from staff, they're pulling from supplies. So you have hardworking men and women who go in there and they're working 12, 16-hour days, sometimes back to back. They're exhausted. They're making, you know, a very low wage. They can't afford their health insurance, and they're in here caring for your parents. They're in here caring for you. Everybody is somebody to somebody, and they're in there caring for family members, and they can't even care for their own family members. I mean, I've had CNAs that I've had to give gas money to because they couldn't get home from the facility.
Right, sure.
You know, and then if they get sick, it's a question of, can they afford to take the day off, right?
Absolutely.
You know, and then they have to come to work not feeling well because they can't afford to go to the doctor, they can't afford to get their medicine. As a matter of fact, at one point in time, I worked in a facility. I come from nursing. I was in nursing for almost 16 years. At one point in time, the facility that I was in, that I worked in, and it wasn't very far from here, if I were to get hurt, I could not be a patient in the very facility that provided my health insurance because they didn't accept their own health insurance.
That's insane.
That's how crappy the health insurance was.
You know what every restaurant I've ever worked in does?
Yeah.
They feed their employees.
They feed their employees. Yeah. There you go.
Yeah.
There you go.
How does that not become a basic thing that you work in a place and you need your car fixed?
Right.
You're going to get your car fixed, you know.
Absolutely.
And then they get these subsidies. They get, kickbacks from Medicaid and Medicare, and it's corporate welfare.
Right,
and then, the same folks that are screaming that, people out here that are working 2 jobs are on welfare and they should get it together. Pay attention. Pay attention. They're not the ones that you should be worried about. It's the corporations that are padding their pockets with your dime.
If we could just stay on that for just a moment.
Sure.
If you look at, now of course we might get into a broader discussion about healthcare or
Not even on the
Obamacare
agenda
later.
But let's go.
But that is always
Agenda. We don't
going
need
to
no
be,
stinking agenda. Yeah.
that is always going to be a problem. That is always going to be an issue. You're always going to have more patients than you have employees, or as many employees as you'd like for proper care. You're always going to have supply issues. So long as hospitals are worried about a bottom line, so long as hospitals are worried about fat dividends, so long as they're worried about bonuses. When you've got perverse incentives, like a director of a department who gets a bonus every time he comes under budget, what is he going to do? He's going to make sure that his staffing is a little bit light. He's going to make sure that his supply orders are a little bit light. He's going to make sure that he gets that bonus, so long as they're just skating by with the most bare minimum.
He wants
of patient
tension.
care.
He wants tension, which creates that margin.
There we go.
Right?
There we go.
Right. Tension between making the people work harder to provide the service.
Absolutely.
Which costs less.
Absolutely.
Right?
And so as long as we have those perverse incentives, so long as these hospitals are for profit and corporate, you're going to have this tension. Healthcare, they treat like any other product when it's really not, or at least it shouldn't be. In Japan, not to get international, but in Japan,
Please do.
there's no such thing as a for-profit hospital. It is a banned thing. It's only non-profit hospitals.
Are they nationalized?
They're absolutely, of course.
Absolutely government
Absolutely.
hospitals?
Absolutely. And they're all run by doctors. You have to have a medical degree
To be an
run a
administrator?
hospital, to be
Get
an
out of here,
administrator
really?
in Japan.
That's beautiful. Does that happen other places too?
I'm sure it's sprinkled
so it
around.
stumped you already.
You got me already.
First question.
I'm sure it's sprinkled
I hit
around.
the
Oh, I'm
microphone?
sorry. Yes, sir. I'm sure it's sprinkled around.
Yeah.
But they've got better. If you go other places, they've got better health results than us anyway.
Well, that's
Yeah.
broadly true of
Of
industrialized
course.
nations.
Of course.
We are one of the things that came up in the discussion the other day, and I only dipped in here and there. I was actually at a seminar, an education seminar. One of the things that I was interested to hear was that employers who do this, who provide full benefits and medical insurance for their employees, understand that that's a huge leverage tool in keeping good employees. That being able to provide health care for people is a big incentive to stay employed. With the company that you're with, not to shop yourself to. So,
That's why we
so
used to
if
call
everybody
those
has
benefits.
shitty health care, excuse my language,
Yeah.
but if everybody has shitty health care options, then why am I married to this job? And Mayor Rob Marlowe of Newport Richie, in a thread where we were discussing this, made the point that when health insurance was offered as a benefit for employees initially in the 40s and 50s, it was cheap. It was a cheap and easy thing for you to throw at your employees that they could get a hospitalization plan for next to nothing. And putting, I had a business owner that was really vocal about her lack of support for ACA because she employs a lot of people. She's an earnestly hardworking woman. She has created a lot of opportunity for the people that work for her. Can't keep good employees, and partly one of the things that's angering to her is how much money they spend on health insurance for their employees because they're required to.
Right.
This is a person who, if someone comes to her and says, I had to have gallbladder surgery, she would literally dig in her own pocket and make sure that you got your gallbladder surgery.
Right.
But it galls her, no pun intended, that's not an option for her. If she has a crappy employee, she doesn't have any choice.
Right.
All right. So I like
Imagine
what takes
that
that
was
a public option.
what takes that all off
Imagine.
the table. That's
Yeah.
an osprey flying right over us. Look at there.
That's a beauty.
This is the best place in town.
So nice.
Taking that, what would take that burden off of her is a single payer healthcare system where it
Imagine
wasn't
that.
her responsibility
Imagine
or even her option,
for all.
and
Imagine
people
that.
would just have health care.
Yep. That would be good for business.
Well, how would but how
they
would that be
always want
good?
to talk about what's good for business.
How would that be good
Yeah.
for you? How would that be good for employees and healthcare workers?
Well, first and foremost, everybody would have insurance.
Yes.
Which hospitals might not want to say this, but Obamacare has been great for them. Obamacare has gotten more people with insurance, so more people come to the hospital for all the things that they need for preventative care. They come get, real doctors. They're flooding the place because when nobody has insurance, nobody's going to come to the hospital
Right.
because they know it's going to cost them an arm and a leg. So they only come in if they're, about to breathe their last breath.
Okay.
So the more people that have insurance, the hospitals love this. Our hospital has not slowed down whatsoever. Just in the past 2 years, we've been expanding constantly. We've built 2 freestanding emergency rooms, one in Citrus, one in Palm Harbor, 2 more on the way. They're going to make another mental health facility where the old one was,
Good.
down on Marine Parkway.
Good.
So they're flush with cash. They're not struggling. The health insurance industry loves more people on insurance. That's
Okay.
more people coming with money in their pockets
Right.
that are giving to them for their services. They jack up the price. So forgive me. No, I'll bring that one back a little bit.
No, you're doing great.
So
You're doing-
okay,
you're on
so
point.
let me square away where people where these groups are
Yes.
position wise. Okay, hospitalization insurance companies, okay,
Yes.
medical insurance companies
Yes.
don't like the ACA. Okay,
They're mixed about it, right? They're mixed about it.
Loretta, what's your opinion there?
I really don't know the answer.
Okay.
I don't.
Okay. So, but the hospital companies, where are they with the ACA? Are they? Is there? I mean, what is? I'm sure there's a national lobbying organization for both of these groups, and I'm really
No,
sure
there
the
is, and I
insurance
was
companies have
thinking
been
that
trying
when
to
you
kill
were saying
Obamacare.
it. Yeah,
right?
well, the hospitals are actually lobbying to keep it secretly.
Say that again loudly.
The hospitals love the ACA. The hospitals would even like a single payer system. I'm not
Right.
going to name a name, but a high-level official in my hospital, in private conversations I've had with him, begs for a single payer system. Begs for it. And he's not a Noam Chomsky. He's not a bleeding heart liberal. He's nothing like
Yeah, it's
that.
funny you
He's
brought it
somebody who cares about the bottom line.
Right.
And he would love it because that's more customers.
Right.
And that's all he cares
More
about.
paying customers.
More paying customers.
It doesn't matter how the hospital. I'm sure the hospitals.
Right.
We don't care who pays.
They
us,
don't care if it's a
as long as
government
somebody's paying for it.
subsidy. They don't
Right.
care if
So,
it's...
so I actually worked in insurance for a number of years. My dad was a career insurance agent. My mom was as well.
Okay.
And one of the
You can
things
tell us
that,
more about
one
that
of
side.
the things I know about that, and I did not sell major medical as a rule. I mean, we offered it, but it wasn't a major thing for us, right? But one of the things that I saw happening with the ACA was one of the things that was most important to me in it was that it set rules for pre-existing conditions. It set rules about caps on benefits. It set rules
Right.
about deductible limits.
Right.
And that's important because without that kind of restriction, insurance companies are free to not give you coverage.
Do anything they
Right,
want.
it's in their best interest
Right.
to collect more money from you for less
Precisely.
service. And to me, that needs to be disconnected. What the insurance companies want versus what I think separating
Right.
healthcare from insurance
Right.
is something that we should think about. Insurance
Right.
as a concept is ensuring that if something bad happens to me, if I suffer a
Right.
loss, that I'm made whole.
Absolutely.
And that's okay as a moral philosophy.
Sure.
But as a business model that pertains to people's physical
Right.
well-being, I think it's not a great model
Ah.
because the profit motive in it
Right.
is so strong and it's so incentivized, especially with stock companies versus public companies, or mutual companies. Stock companies basically are working for the benefit of stockholders, not for the benefit of policyholders.
Right, sure,
Right.
sure. Well, it comes down to the basic principle, doesn't it, that in this country, as opposed to in other places, we treat healthcare as a typical commodity, like
Yeah.
an orange.
Yeah.
I'm thinking of trading places. Whenever I think commodities, I think
orange juice.
frozen orange juice.
Orange juice.
But we
Orange
treat
today.
we treat it as if it's like anything else, and we cannot. If you, God forbid, my friend, if you have a heart attack right now in this dock,
I'll have 4.
I
and
rebuke that.
well then,
Jesus.
I take that back. Something else. I
I'm
wish
disaster-proofed.
I'll-
I had a bypass. I had a bypass 3 years ago.
Oh my!
I'm
Wow.
52 years
I'll
old.
wish a different calamity on you then.
Don't wish any of it.
No, yeah, no.
Some other thing happens to me.
Some
All right,
person
to me,
who we don't like.
If I collapse on this ground, we don't know what's wrong with me.
If, say,
I
Bill
collapse on this-
Akins.
I was thinking. That's good.
If
No,
Bill
I wouldn't wish
Akins
that on
finally collapses from his foot and mouth disease,
I'm listening. Go ahead.
and we have to take him to a hospital,
There we go. Okay.
are we going to drive by the hospitals and Are we going to say, hey, which
Where's the
cardiologist
cheapest?
is cheaper?
Right.
You know, which
Right.
anesthesiologist is cheaper?
Right.
Right.
How can I window shop this while my friend is freaking dying in the back seat? It's not practical. It doesn't make any sense. We cannot treat healthcare as if it is a typical commodity.
Because it isn't.
Because it isn't.
Amen.
Precisely.
Yeah, and so this is the thing for me, and I guess I mean I know we have a set agenda of things we want to talk about.
I didn't know that.
But one of the things that I would like to see people be able to do is disconnect their idea of insurance from their idea and need for health care.
Okay.
Because I really believe that insurance companies are the heart of the problem here. I believe that the insurance company's profit motive. I understand that hospitals are companies that have profit motive.
Sure.
But the people that work in hospitals, because they are healthcare workers who are deeply caring about people's actual people,
Right.
are, you know, yeah, I would love for my employer to make a profit because I have a retirement plan that is vested in
Right.
them doing well.
Right.
That's great.
I take care of them, they take care of me.
But saying that I can get by with 30% less syringes or 30% less RNs in a hospital
Right, sure.
is not serving the patient. And if my job as a healthcare worker is to take care of patients,
Right.
that needs to be my primary concern. I worked in mental health counseling for a while. I've been kind of around the world here, right? And working in mental health care, one of the things that was always obvious, we served DCF client families that were in jeopardy of losing their children because of a myriad of underlying causes.
Sure.
Sometimes addiction, sometimes mental health issues, sometimes just strictly abusive homes, and people that can't pay for those services themselves, and mental health care services are very expensive and not available to people. You know, when people are having mental health problems, they often are dysfunctional in other ways. So a lot of the people that came to us were people that were on Medicaid or Medicare or were not able to pay for services. So GCF funds services for some of those troubled family systems, okay? And our goal, when you came to see us and we identified the services you need, and you, particularly people that said, I'm drinking alcoholically and I need to stop. Our goal is to get you sober and help you stay sober and build a life that is healthy for you. It doesn't kill you or your family system.
Right.
But we were often told, well, you know, you have to wait for the funding to help these people. So slap a Band-Aid on them, send them home, and when the money comes through, you can see them again.
Right.
Let me tell you
Frustrating.
something. When somebody shows up in your facility ready for help today,
Right.
fucking help them.
Yeah.
That's what you do.
You gotta go.
You don't wait.
What kind of risk do you incur
oh,
by
please go
turning
wait in
them
the
away?
lobby with a
Yeah.
tourniquet on until your insurance card clears. Is a ridiculous model for
Right.
saving people's lives.
Right.
Yeah.
Absolutely.
Okay. So what else do we want to talk about? Let me let you drive for a while.
Oh no, I'm fine. I'm enjoying this conversation. This is good.
Well, why don't we recap the town hall?
Yeah.
Yeah. Let's talk about the town hall.
So how do you think
Oh, man.
Bill Aikens did?
We're gonna open with Bill
I
Aikens.
think he opened
Where can
it.
you go from here?
It reminded
He started
me,
the party.
You a football fan? my
Yes,
man?
yes.
It reminded me of a perfect kickoff to a football game.
Right?
Kick the ball off.
Really? He was the first person that spoke?
Second.
Holy
He was
smokes! I
the-
didn't know.
He
I
came-
didn't know that.
Heavy collisions. There's a fumble. Somebody's helmet popped off. Somebody's hurt. Concussion protocol. Right off the bat. I loved it. I was excited.
So let me ask you, because I wasn't there. Do you guys sense that that Bill Arrakis was put on his back foot right away because of that?
Let me just say
Take
this.
it.
Let me just say this.
Take it.
Okay. I'll say one nice thing about Bill Arrakis before we pull out the daggers.
Okay.
I'll say one nice thing. I've been to a town hall or two before. I've seen them televised. You know, you hear about them and stuff. And I was expecting Mr. Bill Arrakis to sort of have a little shield up or something, maybe be behind a podium or something to that effect. I'll give the man a little bit of credit. He stood from the people.
He was right
as
down
close
there in
as
the crowd, right?
As close as you and me were.
That's
Handed
how
him
they
the
be.
mic himself.
Nice.
Let everybody say their piece, whether they were with them or mostly the folks who were against them. Let them say their piece. So I'll give him that much.
Okay.
All right, I'll give him that
I'm
much.
going to contribute to that. He appeared to be actively listening.
Appeared.
Just the way you say that.
It
He
did.
appeared to be genuinely interested.
Right.
I zoomed in on some of his reactions. He
Yeah.
was so sad at some times.
He was doing
and
with
he
us
was-
what his marriage counselor tells him to do with his wife.
Oh, no, you didn't.
Which is what? You know what Steve Martin says, right? Sincerity is the key. Once you can fake that. That's an old Steve Martin line. Sincerity is the key. Once you get fake sincerity, you've got to.
I want to tell my girlfriend that later, but I don't think I'll keep that in my back
Yeah,
pocket
you better.
instead.
You better. All right. So,
man.
so, you guys have participated in the other town halls that how many have there been? This is the third
This
one?
was the second.
This is the
I
second.
was not at.
Is there
going to
be another one?
There's supposed to be a third one in
What is it, Land O'Lakes area?
right somewhere.
Do you know when?
Down there. It'll be on a Saturday. I've been monitoring.
Okay.
I've been
He's
trying
gonna
to
post
see.
it.
Yeah, we'll find out. for
I'm
you.
actually
We'll
going
find
to
out
be
for
really
you.
surprised if he doesn't decide to cancel it. I think they. I don't know. I got the sense that was it your sense that the crowd was mostly keep the ACA? What are you doing?
Oh, absolutely.
The
Yeah.
crowd was mostly
Pro
hang
ACA.
Billaracas.
Okay. All right. All right. So let's call them strongly pro ACA.
It had to be, no joke, no exaggeration, 90-10. I think.
This is
90-10.
amazing because we are a scarlet red county. You know, we are an overwhelmingly red county. So it's
Absolutely.
surprising. Like, I thought there would be more death panel guys.
Right,
I really
sure.
thought you would
Sure.
see more, like 40
Absolutely.
or 50% of the people there
Absolutely.
standing up, especially because Bill Aracus seems pretty popular
Right.
with his constituents. It seems like he would have been able to get
Yeah.
more people to come out and speak. No?
Yeah, sure.
What do you
What
think,
was
Laura?
interesting to me, yes. I mean, you would have thought he would have had more people that supported the repeal in
Right.
the room. That was one of the things that struck me first.
Maybe
was-
they're disinterested because Medicare people are kind of they're taken care of.
No, that's
Yeah.
true.
Well, there were some of them in the room.
There were
that
some of them
stood
in the
up
room.
and said, you know, everything's fine. I'm covered, and
Yeah.
you know,
Good for
life
you.
is good, and do what you got to
Good for
do.
you.
Yeah, I think all three of them that spoke were covered, right? Oh, well, except for one business owner.
There was one business owner who spoke, I'd say, about midway through. And he was all you people,
Oh, you
verbatim, all you people are just sucking on the government's teat.
Nice.
Unlike me, I got my life in order. You schmucks are just, you guys got to pull yourself up by your
And
bootstraps.
again, I would love to remove that burden from that business owner. I would
That'd
love
be
to
nice.
make that whole
That'd
this
be
whole
nice.
argument not his problem.
That'd
I'd
be
like to
nice.
make it so he doesn't have that as a cudgel
Right.
or
Amen.
a lure. That he has to find another way to motivate his employees to show up and not be lazy.
Right.
Than to blame it on their lack of
Right.
health care or their desire for health care.
Absolutely.
See, and that's the thing for me is there's a difference between desiring health care and desiring health insurance.
Right.
Okay.
Right? Health insurance is a benefit as part of your job.
It's a business.
Right.
Right, that's a business, but
Right.
healthcare is a dire necessity for
Right.
all Americans.
It's a human right.
It's a human right, and like education is a right. Right? Why isn't healthcare a right? Why are we
In the
treating it
greatest
indifferently?
country in the world, why is it?
Yeah.
You know,
Can you talk for a minute about our health outcomes and our costs related to other? How do we stack up against Japan for healthcare costs? How do we stack up against Canada for healthcare
Right,
costs
right.
and outcomes?
I think that they put a lot more into preventative, so they don't pay as much as we do, right?
That's a
They
real
have
point.
healthier people.
They also have $9 a pack cigarettes.
Okay.
Having lived in Canada, I can tell you that's the fact, Jack.
Oh, man.
You know,
Yeah.
Actually, there was a physician that stood up and was saying that since the Affordable Care Act has been in place, who was that physician that stood up? Was saying that the patients are coming in healthier. You know, they don't have as many sick people
Right.
coming in. There's
3
not as much-
physicians rose to speak.
Right.
That's awesome.
Yes.
And all 3 of them, mind you, were pro Affordable Care Act.
Okay.
Patient protection and Affordable Care Act, as one pointed out to us.
Right.
And all 3 of them were pro. And
Well, why are we not hearing more from organizations of doctors? Why do you think we're not hearing more from
that's an interesting
Medical group
question. That is
providers?
a very
I
interesting
think
question.
that some of them are lobbying secretly, you know, like not maybe secretly, but just
Yeah,
we
yeah,
don't know about it,
right.
not publicly
Right.
lobbying, but they're lobbying for it. And then I think that, you know, there was a forum created, there was a platform made in this heated debate, and they heard about it and they showed up.
Right.
I think if we were talking to them, you'd see more.
Right.
You know, if you said, hey, look, we're having a town hall with Gus Billaracus, we want to talk about why the Affordable Care Act is a benefit, they would come.
So, well, we could put together a panel of say 5 doctors and
That'd be
invite their
interesting.
Yeah.
opinion out
Yeah,
in the open,
absolutely.
right?
Absolutely.
I
I,
would-
don't think it would be a challenge at all. To do
Well, I
that.
want to make sure that people know that that's what we would like to do. Like where we see ourselves, and this is not about me today or about Corey today, although he says he's on his way. By the way.
Okay, cool.
I would like to see that. I'd like to see a panel, and if 30% of them were for it and 60% of them were against it, great. Let's have that talk though. Let's let doctors talk
Right.
about their observations of 8 years
Right.
of this and how that's creating different patient outcomes. I think that's the most important discussion to have.
Right,
Aside, there's 2 important discussions in my opinion that we need to have. The one is patient outcomes are improving.
Right.
for people that are eligible for the ACA,
Right.
that are on the ACA. Second is that the people that are working in healthcare systems
Right,
benefit
right,
because
that's it right
there
there.
are more patients, more engagement, more opportunity, more jobs, more
Right.
hours,
Right.
There was
more
actually,
money to be spent at that jerk's business where he
there
doesn't
w-
want to pay his
yeah,
employees for health care.
There was a physical therapist that stood up, and she was very concerned for her patients. Do you remember
Oh,
that?
that's
There was
right.
also an administrator that came in the healthcare system, and she was very concerned
Right.
about repealing the Affordable Care Act
Right.
because this is really, they're seeing people, and like I said, I think here in Florida, especially in this area, you know, we have, our healthcare providers are exceptional. I mean, we have
Right.
nursing staff and doctors that treat you like family.
Right.
You know, so they came out and they were pouring their hearts out, and it
Right.
wasn't so much for themselves; it was because they were worried for their patients.
Right.
Right. I'm gonna hit a few comments here and
Sure.
mention a few people that are watching. Let's see. Let me scroll back up there. You were right, Loretta. This guy's sharp as heck.
Yeah, he's great.
So that's for B.
Who said
by
that?
Corey. By the way, he said he's on his way. He'll be here shortly. Shots fired. I think that was about going after Bill Aikens right off the hop.
Shots fired.
Eric Canty, our friend Eric Canty, said good stuff. Hashtag shake up the system. Right. Michelle Zoe Rhodes said boo. I hope that's not. I don't know. She
No,
liked,
it
she
was
loved
probably
this.
she was just chiming in.
Yeah,
as if she was sitting
that's
here.
why they don't like the discussion about civil and human rights. It personalizes the issues.
Yeah.
All right, that's why they don't want to have that discussion because then they have to tell their constituents, no, we don't want what's best for you. All right? So there we go. Inbound, yeah. Oh, also sharing is caring. That's something
Yeah.
we are fond of saying here. If you're watching this feed right now, we would really love it if you would hit the little share button at the bottom right corner. You can invite your friends individually, I think. You can just share it to your wall. You can reshare it to other groups you belong to. We would love to have people tune in, chime in, and get involved. Get involved.
Absolutely.
One last thing about what Loretta was just talking about.
Only one?
I could be only one for now. I could be mistaken. Somebody,
No.
one of your listeners out there might be able to correct me. But at the town hall, not a single person who actually worked in the healthcare industry. There was an administrator. There were a couple of physical therapists. There were the 3 physicians. I don't recall one who was actually in agreement with Bill Arrakis or Paul Ryan's ideas about what to do and how to reform or repeal and replace. All of them were for keeping with the current system and tweaking it in some sort of beneficial
That's right.
manner.
Repair it, not repeal it.
Has
Repair it, not
anybody
repair
been able to make clear to you guys what the replacement plan is? I mean, do you get any? I don't follow this on a daily basis, but I don't get any sense that. I mean, the last thing I heard was it may take 2 years to replace it. What does that mean? If we're going to repeal ACA this year
Right.
and not replace it for 2 years,
Right.
what happens to all the people who are benefiting from the ACA in the interim? Do you know what the plan is?
There's one out there floating around. I
Oh,
haven't
thank
read
God.
it. Yeah, I haven't read it. I know it's already like they're trying to look at it and vote on
Right.
it, and I haven't read it. But as far as I know, the current situation, they are looking to just repeal it and then replace it, which they shouldn't do. We need
I
to
don't think
keep-
we should. I don't think they should be allowed to do
I
that.
know, and there's a lot of things going on that they shouldn't be allowed to do, but they're doing it anyway, right? I mean, these are critical times. Like we're in a state of emergency here. Right?
Yeah, I think we are.
So.
And I haven't wanted to say that, but the last 2 weeks it's been
Yeah,
really this is
I mean,
an emergency.
I would love to wake up one day and not read the news and have a panic attack.
I'm reminded
How
of
is
that.
this?
There's an internet meme. It's a famous painting of somebody. I can't remember who. I think it's the architect of St. Paul's Cathedral in London. So he's in front of a window. He's pointing out the window. And there's a fire behind him. It's the Great Fire of London. And it says "Shit's on fire, yo." I honestly think we're at the "Shit's on fire, yo" moment here.
Gotta
Sorry,
get up at
please
midnight
continue.
to check check the news. My
Right?
husband's like, "Are you reading the news in the middle of the night?" And I'm like, "I can't stop."
How can you not? Right? Yeah. So please, you started to say.
So, I think what it's going to boil down to is we're going to have to put, and I know I'm going to lose a lot of interest here, but they're going to have to put a higher tax on the wealthy, because there's an ill distribution here, and I think that's going to solve a lot of this, because we need health care. It's a human right. They have to have it. They work, they provide a service, they deserve to have health care, and that's the bottom line. That's what it's going to take.
Right.
I mean, cut through all the other red tape and the bullshit. That's
So
what it's
here we
gonna
are
take.
with an administration and a Congress
Excuse
who
my
are
language, guys, I'm
absolutely
sorry.
in no way prepared to discuss raising people's taxes. It's not something that they're going to be at all interested in discussing, and I think they're going to do everything they can to avoid that discussion or to ridicule those who want to have that discussion. Do you agree or disagree?
Absolutely.
I agree.
Well, you know what? That was cagey. Do you
They don't
agree?
wanna hear
Do you
it.
agree or disagree?
But I'm
Yes.
not talking about putting it on the middle class. I'm not talking about putting it on the small business owner. I'm talking about putting it on the billionaires. I'm talking about putting it on, big oil. Let these guys pay their freaking share. I mean, how much money does one person need?
Right.
Honestly, and when we get into
Right.
negotiations, I'm going to bring you some stats, and your jaw's going to hit the ground. I can't release that information right now.
Right.
But I mean, it's just gross. It's
Bonusing packages
disgusting.
for CEOs and,
Right.
Yeah.
and boards of directors
Now,
is criminally
if we think-
ridiculously
Absolutely.
big.
If we think for a moment that that's going to change,
Right.
when we've got the Hardy CEO, when we've got ExxonMobil CEO running the State Department,
It's going to take the people to
There's-
change it. And we can do it if we all just...
Okay, so let's talk about how do I impact this discussion?
You?
Well, I know how I do. Let's just say that I don't have a Facebook show. By
Right.
the way, the Facebook show it's my feed. Everybody has a Facebook show.
right? Sure.
You hit the live button,
And you have a
you
show.
talk. Everybody can do this. Now, if you can you get people to watch you in numbers? I don't know.
That's the
if you're
question.
charming and beautiful like myself, it's
Right.
a little easier.
It's simpler.
But the point is that we.
Effortless for you guys.
Sure. What's this like? It's like falling off the dock. Except we try not to fall off the dock because shit's expensive. But you see what I mean? How does an average person that's working a day job impact this discussion?
Well, today, for example, we have a call to action to call Congress on Valentine's Day, and I need to put this out there.
Please
okay?
do. That's
Because
why
this
you're
is
here.
a way that everyone, even if you're working 2 jobs today, you're still going to get a 15-minute break. It takes literally 2 minutes to do it. We need to call this number, and we need to tell Congress not to repeal the ACA, but replace it. We need to let them know that we need to keep our health care, but they need to help fix it. It does need to be fixed. I agree. There's a lot of issues out there, but they need to not repeal it because too many people right now are counting on their health insurance.
A plan that's not perfect is better than no plan at all.
Right,
Sure.
absolutely.
Okay. And-
So on Valentine's Day, our plea is that you call 866, it's called a call to action, 866-426-2631, and you'll just put your zip code in there. I don't know if you guys could hear me, 866-426-2631. Put your zip code in when they ask you, and it's going to send you to your local representative or whoever your representative is, and just leave a voicemail and blow up their lines and keep
Yes.
doing it because they
Yes.
need to hear from us. That's how we moved them to do these town halls, was by blowing up their phones.
Okay, B, so here's what we're going to do right now. You ready for this?
Yes, sir.
You guys are going to love this. You're going to dial the phone, and I'm going to talk to my representative.
Deal.
While we're on.
Let's do it.
Let's do it. So you're going to see how this works. This is how easy it is for you to have an impact on this discussion. While he's doing that, Zoe said the
Hey,
elected
Zoe.
the elected think that they're
Related.
dealing with sleeping Americans, and we've woken up, and we're not going to let them keep running over us, doing whatever they want anymore. They have no idea what's brewing.
4. I like that
Yeah,
comment.
well, Zoe's a firebrand. And believe me when I tell you, her cause is a lot more controversial than yours.
Uh-oh.
Oh, yeah.
Yeah, she's
What is that
she is
exactly?
consciousness for cannabis, and she is a daily activist for legalization of cannabis and normalizing cannabis as a thing that adults
I'm
should
sure
be
she
allowed
is
to
a
do.
daily activist.
She goes on Facebook Live every day and smokes cannabis
See.
on Facebook.
on Facebook.
All right,
What's
let me
it
put this
saying?
on speaker. Hang on. Speaker.
There you go.
As we know it, this would cause chaos, taking healthcare away from millions of hardworking families and putting our entire healthcare system in jeopardy. To be connected to your representative, please enter your 5-digit zip code, followed by the pound or hash sign.
And guys, by the way, we're just behind New York in volume of calls across the nation. So everybody needs to call. I want to be in New York today.
Who answers the phone or leave a voice message saying, "Do not repeal the Affordable Care Act, and to protect Medicaid and Medicare, please hold for Congress."
Expand Medicaid.
It's ringing.
Think I'm gonna get a person. So whose office would this be? This would be Bill Racker's
Yeah.
office, 34667, right? Hudson.
For calling the Washington, D.C. office of United States Senator Marco Rubio for Florida.
Oh, you got Rubio's office.
We
Okay.
got little Marco.
If you are receiving this message within this hour, we apologize for the inconvenience.
They don't know where he is.
If you are calling regarding the legislative issue, please leave your opinion and the zip code of Florida you are calling from after the tone. If you are calling to reach a specific staff member, please leave a detailed message after the tone, and someone will be back to you shortly. If you are calling regarding casework, please call our Orlando, Florida office toll-free. That number is 1-866-630-7106. We would also encourage you to visit our website for timely updates at www.rubio.senate.gov. Thank you so much for calling, and have a nice day.
Hi, my name is Greg Smithwick. I live in zip code 34667, which is Hudson, Florida, in Pasco County. And I would like to remind Senator Rubio that repealing the ACA without a viable plan to replace it is a bad idea. Millions of Americans count on the ACA for their health care needs. It may not be a perfect plan, but it is a plan in place that is helping millions of Americans. And I will hold Senator Rubio accountable if he chooses to vote to repeal the ACA. Further, while I have you on the phone, I'd like to express my concern that we haven't heard from Senator Rubio this week, and I'd also like to remind him that voting for his kids instead of mine in confirming Secretary DeVos for the Secretary of Education job was a bad idea, and we're unhappy with his performance here in West Pasco County. Thank you.
Done. That easy.
I have just impacted the process.
That's right.
This is the control that you have. You may watch the media and think you don't. You may feel disconnected from these politicians. Just called their office. I called our U.S. Senator who voted to confirm Betsy DeVos as the Secretary of Education, and he collected $94,000 in contributions the day before he did it. So he definitely voted for his kids, not mine. And it's okay for me to call his office and express my displeasure. But so give them the number again. Look at the hearts flying by the screen. People are actually responding well
Love
to this.
it. Call everybody
I'm really
and
excited about
push
that.
this past yourselves too. I'll give you the number one more time if you want it. 866-426-2631. Ask your family members to call. We got to blow them up. We have to blow those, not literally, but to blow the phones up. We have to.
We're not pulling a Madonna.
We're not
pulling a Madonna.
I meant, bring the phones off the hook.
It hasn't come to that just yet. Oh man. But let's just.
So we
So
just
we'll
did
do our
that.
part,
That's
yeah.
what
I just did that. Now see the thing about this is like one of the things that I've learned in the year that I've been doing this. I started doing this December of 2015, and I was really shy about calling local officials. And I've been really surprised at how available they are to me.
Right.
County commissioners, city council members, really available to me.
Right.
State legislators, available to me. And that's because they know I'm an opinion shaper. And if they refuse my call,
That's good.
I'm going to talk about them.
I like opinion shaper.
Right? I'm going to say, I offered to have him come on the show, but
Right.
it's too chicken to be here.
There you
Because
go.
that's what's going to happen Friday. I invited
Right.
Bill Akins to come explain to me, show me on the doll
Right.
where the bad man touched you.
Right.
I invited him to come
Well-
show me where these death panels are enumerated in the ACA.
Okay.
But I know he won't. I'm really hopeful that other people in the Republican Party will either come and show me where the death panels are, or explain to me that he doesn't represent them and fire his
Right.
ass for saying egregiously racist and awful things
Right.
about people I care about.
Amen.
So there you go. Sorry, I got off on
No, that was good.
I don't
That
know
was
about
good.
Mr. Akins' bigoted views, but
I do.
If to put that aside, if I can defend him by excoriating Mr. Bilirakis, okay? Because at that meeting, after Mr. Akins mentioned his death panels, he looked to Bilirakis for confirmation. And this is what Bilirakis did. I gave him a little praise earlier, but he did one thing, that I could think of at this moment, that was just unconscionable. And he nodded, he validated this man's preposterous idea, this idea that this man got from Sarah
Interesting.
Palin or whomever, and he offered up the iPad section
Right.
of the deal
Right.
that deals with end-of-life care, something like that, and he pawned that off as validation for this man's issue. So, with death panels. So, as much as Akins might be an odorous figure for other things,
Yep.
his belief on this issue is propagated
It's supported.
and supported and validated by Republican officials who are
Interesting.
using that mischaracterization
Elected
to their
Republican
advantage.
officials.
Elected.
Right.
He did not at one point deny it. Two people came up, a physician included, to specifically repudiate that claim. And it took them to make sure that falsehood was put into its place. He did not. He did not at one point.
I would remind our viewers that there was a famous moment in the last presidential election cycle where somebody at a town hall did essentially what Bill Aikens did and talked about I'm trying to remember. He impugned Muslims in a really direct way. This guy said these Muslims are all coming here to kill us. And John McCain said nope. Took the microphone away from the person.
I remember that. Yes.
And excoriated them, chastised them. Don't bring that here. That's ridiculous, racist nonsense you're spewing. Stop doing that.
Right.
That's what statesmen do.
Right.
That's what responsible elected officials do. I talked for a half an hour this morning about one of the things that I seek to do better at is to listen respectfully to the other side, to understand that some people on the other side have valid viewpoints that may be overwhelmed by more egregiously ridiculous opinions.
That's the TED show, right?
Yeah, the TED lecture about how to speak to your opposition, how to speak to your opposition in a way to convince them of your viewpoint is to engage with some keywords that they believe in. Like Republican or conservatives respond more to authority things and purity things. Right? So if you can say we want to keep the environment pure, conservatives will actually respond more positively to that. And so this was about shaping your language in debate. But more importantly, I think, is the idea that I know there are some good conservative ideas.
Sure.
And if Bill Arakis wants us to take seriously his contention that there are good conservative ideas, he's got to shit can the bad ones loudly. He needs to do it. Like it can't be the Democrats that impeach Donald Trump.
Right.
It really has to be his own part. The Republicans have to take, if we want positive change, they have to bring it. If I want positive change, let's just say that I want cannabis legalized.
Right.
Okay.
Let's just say.
Yeah. Because I do. Okay. So I can speak with some authority on this issue. What doesn't help my cause is being an out of control, unmanageable stoner who gets in accidents and hurts people.
Absolutely.
Right. Someone who endangers children's lives or espouses selling drugs to teenagers. Those are not things that are going to help my cause.
Right. Sure.
What also isn't going to help my cause is saying that it's a giant government conspiracy to keep me down.
Right.
Right? It is.
Yeah.
But not for the reason people think.
Richard Nixon admitted that it was.
Like the original reasons for outlawing cannabis had nothing to do with its danger. They had to do with racial profiling.
Right.
It had to do with having reasons to negatively interact with brown people. The people that were initially singled out as users of marijuana and abusers of marijuana, and by extension abusers of white women, were Hispanic and African American people.
Right.
And so vilifying them was a very easy thing to do.
Sure.
And so that argument, unfortunately, has taken root in our conscience, our consciousness. And so what I'm telling you is, if you advocate for a position, you need to be a good example for that position. And if your position is that the ACA needs to be repealed, what you need to be doing is telling us responsibly, accurately, and honestly what our alternatives are.
Right.
And yelling and screaming about death panels and calling people children doesn't really further that idea. I got accused last week of being threatening at a city council meeting.
What did you say?
I told them that we felt like the county had dragged their feet with dispensary moratoriums, that the clear express will of 71% of the people, conservative and was instituted. That's what we want you to do. That's what we said. And your job then is to make that happen. And when the county said we need another year moratorium after 2 years of moratoriums, it feels like foot tracking. So what I said to the city council is, maybe you have a perfectly good legal reason for this moratorium. But if we sense that you're dragging your feet, we will hold you accountable by unelecting you. And 3 of the city council people chastised me and said I was threatening them. Well,
the only one.
What?
But I was strident. I was forceful. I was in the moment.
But you didn't threat physical violence.
But I've been thinking all week all week about how I could go there and be more reachable to them. And I should be. So my job in this is to be more reachable and reasonable and discuss it rationally.
I think I'm in the same position you are with this, is that, I've learned that, burning bridges is not necessarily the way to get what I need to get from these electeds. I can't go in there and just blow them up and threaten them and walk out. I have to, that's why I was saying that we have to really take and pay attention to what Gus Bilirakis is interested in and then try to move him that way. But unfortunately, it really seemed like, I felt, this was my take on the whole town hall, I didn't feel like he was there to really listen to what we were saying. I felt like he was there to appease us.
Right.
That he went in to just say, I went in and I listened, but yet still.
There was no way.
Well, I thought there was a quote from him a couple of weeks ago where he said something along the lines of, I'm I'm gonna listen to the people who agree with me.
Yeah.
Oh,
Thanks.
Or who says what I want to hear. Or
Welcome
what
to
I
the
like,
echo
or,
chamber.
You know, and that's
yeah.
not.
Well, we gave them no choice on that matter.
Right.
But
I mean,
All right, I'm going to jump up and let you guys talk for a minute. I'm going to hook a
Okay.
battery up to my phone here because we're getting a little low battery signal. So
I mean, don't get me wrong. There comes a time when we can throw some shoulder, right?
throw some shoulder.
There
I like
is. There comes a time when
Throw
we
some
can,
bows.
yeah, we can do some stuff.
I
you
like
know?
that term.
And you know this, right? I mean, there are times when you go in and you reason with people. You know, we reason with them and we try to, you know, appeal to their compassionate side and we try to move them, and that makes sense. And we give it every effort we can to work with them.
appeal to their wallet sometimes.
Yeah. I mean, but if that all fails, you know, when the time comes, we have to be ready. We have to be ready. We have to be getting ready right now to make drastic changes in the next couple of years.
Right.
You know, and we need to be prepared. That doesn't mean that.
Speaking
you know,
of being prepared, I didn't bring the right cable to charge my phone.
oh, all right. So we're gonna end early.
We'll go until it runs out.
All right.
We'll go. So if we abruptly stop broadcasting, you'll know it's because Greg's an idiot, which is often why we stop broadcasting.
Which is awesome.
It's the most common comment. All right, so I got some more comments here. People that need to be held accountable. Bill Bunting is another person that said some pretty unreasonable things from the conservative side of this, espouses some ideas that are not actually true or real. Eric Canty, hashtag good old boy system.
Amen. I know.
Yeah, that's
I know.
a problem for us.
Eric,
Susie
I know.
McAnally says, who on earth would take advice from Sarah Palin? He definitely needs to go. Zoe says, this administration reminds me of an 80s After the Apocalypse movie. Well, it's going to look like that when they're done.
Anyone seen Blade Runner?
What's that?
Anyone seen
Oh, yeah.
Blade Runner?
What happens when you listen to the other side and they start off with, Milo Yiannopoulos says, he's the ultranationalist.
Oh, yes.
Yeah.
Yes.
People are angry. They were sexist to me. Zoe makes a good point at the city council meeting. Now, this is the thing that perceptively, I know I have some privilege in the room. Okay, and I'm known to them. That's why Jeff Starkey. I'm sure
That
he
was
has
clear.
never listened to a single So Local Pasco podcast. His brother Frank has, but are they brothers or cousins? I can't remember.
I don't know.
I'm absolutely sure Jeff Starkey's never listened to my show. Corey, do you have a USB cable for an Android type device?
USB for an Android?
Yep, for battery.
Very light. Oh, for a battery? What's that?
Run from the battery to the phone.
Oh yeah.
Hey, Corey.
Wait, is that how that? Wait, that's. Not what I need.
So I've been watching the whole time. You guys are
Oh,
awesome.
I got
sauce.
this wrong. You know what? You can do this for us if you would be so kind. Just connect that to the phone and the other end to the battery. I had a brain fart there. Forgot what I was doing. Anyway, Zoe was not the only person that observed this. Carrie Showles DeLaff and a couple of other people, women, noticed that I was sitting behind Zoe. So when they were addressing the threat, Zoe said, "We're going to unelect you if you don't,
Right.
if you don't square up." Everybody reminded me that they treated her very differently than me because after our session, I was in the hallway and I talked to Jeff Starkey and I talked to Mayor Rob Marlowe, who I have a pretty good rapport with, and I tried to talk to Bill, and Bill Phillips. He was not excited to hear from me. He remained angry at me, and I think probably is still angry at me because how dare you? You know?
Yeah.
But my point is that none of them spoke to her, and
They
in fact,
actually
some of them
walked
turned their
between you guys.
backs
Yeah, I
on
saw
her
that.
to address me.
That was
So she was
disrespectful.
definitely treated with less respect than I was treated
Yeah,
with in
that
that,
was
in that
awful.
environment. And I think it's important that we point that out. And it may be unintentional on their part, and if it is, now they get to fix it.
Yeah.
Right now that we've
Right.
expressed that it happened, they can take care of that. So,
I like apologies for things like that.
Sure.
yeah,
Yeah, I
think
like to
that's
call
that's
people out and
appropriate.
ask them, point out what they did because they may not have realized it, and then be like, she deserves an apology for that because
Right.
she's my equal. You
Right.
know, she's a constituent, she's a tax-paying citizen.
Yep.
She came here to speak her mind, and we both basically said, the same thing, and you all addressed me and just turned your back to her,
Yeah.
and that's just not cool.
I will say that the next day, Mayor Marlowe did call Zoe. The email they had
Okay,
an email exchange,
okay.
and so he did reach out to
Right
her. He was a little. He chastised me a little the next day. If you want to get through to us, and I did remind him though. You all said threatening us doesn't work, but it did
Right.
because when you started, you were on a 1-year moratorium with no workshops, and at the end of the meeting, we were in a 6-month moratorium with 2 workshops. So
How sweet
you
it
can
is,
say
right?
it doesn't work. You can say it won't work the next time, but it worked this time.
Well-
So when you tell your kid don't do that, it doesn't work.
Precisely.
Right after they made it work, I didn't like the condescension in the room. I felt like they were unhappy that we were going to that they didn't just get to vote 5 no or 5 yay, no 0 no,
Right.
bang, done.
Right.
They wanted to zip through that agenda item in 30 seconds.
And they would have if we weren't there.
Absolutely, they would have. And we only found out about it
I think
because
I invited you to that, but it
somebody got the agenda
like
who
no
happened to be
notice
there for
involved.
Tasty Tuesdays, which is a co-op that happens on the library steps. And somebody handed her the agenda, and she happens to be a cannabis activist. So we had no idea that was even going to be on their agenda, and somebody happened to find it at 2 in the afternoon. So we had 3, and it was funny as Mayor Marlowe, I guess maybe 5 or 6 people spoke, and I said to Marlowe, imagine if we'd had more than 3 hours notice. There would have been 40 people down here talking to you about what a bad idea this is.
I would have
So
skipped work.
it was pretty cool.
Yeah. You know, Greg, that very same thing happens in Tallahassee.
Right.
That they'll slip an agenda item into a different committee that's not relevant. Like they'll take a healthcare issue and put it like a budget, and
Sure.
it'll be done an hour before the meeting, and then they'll all just clean up on it. You know, they'll all just vote. There's
Right.
a real that buddy system, the good old boy system that you know Eric pointed out.
Yep.
That exists in Tallahassee as well. That's why it's so important that we have a presence.
Right.
We have to be in our city town halls. We have to be in with our county commissioners. We have to be in Tallahassee. We have to have a presence.
Yep.
At all times, we got to be watching. We got to be awake and alert. We
Yeah.
got to be ready. You know.
Earlier in
and-
the year, and I'm not a one-issue guy. It just happens to be a thing I'm paying a lot of attention
Right.
to. Earlier in the year,
all right.
I happened to randomly be watching a county commission meeting where medical cannabis was on the discussion agenda, and in the video of it, I watched Catherine Starkey and one of the other county commissioners, and I can't remember now who it was. It might have been Jack Mariano. Referred to cannabis patients as those people. You know, those people can go elsewhere and they won't be our problem. And they laughed among themselves. And that was what galvanized me to show up out there
Right.
and wag my finger at them and say, I want
Right.
you to recognize that those people are my aunt.
Right.
You know, those people are medical patients with medical conditions like MS and cancer.
Yes.
So laughing them off as some sort of a joke is
Right.
incredibly offensive and inappropriate. You know, the other night at the city council meeting, Bill Phillips wanted to compare where they're going to put cannabis dispensaries to zoning adult use ordinance,
I know, I
which
heard.
is porn shops.
I heard.
Did you really just compare my aunt, a medical
Yeah.
cannabis patient, with people that consume or purvey porn? Not that there's
Oh,
anything
my
wrong with that, but the comparison is jarringly offensive, and
Oh,
that he
my
couldn't see
God.
that. I know he was trying to say, well, it's a difficult problem. No, it isn't. If it was a difficult problem, there wouldn't be a CVS and a Walgreens on every corner in downtown on Main Street in Newport Richie. But there they are,
Can
selling
you imagine
opiates.
having to drive Granny to the toy store, we'll call it?
Oh, no.
Just to pick up her prescription?
Yeah,
For
I
God's
remember
sakes.
that fight. It's the pink pussycat that's out there in the industrial park on the east side of Congress.
Oh,
That's funny,
God.
except for this: when you put dispensaries in those places,
Yeah.
there actually is more crime associated, and the patients are in danger. Putting them in shopping centers in the middle of downtown is where they need to be. They're
Right.
easily accessible to sick people.
Right.
That's where they need to be.
Right.
They don't need to be out in the middle of nowhere. That's not a good outcome. So that on its face is not productive.
Right.
But that's what they think their constituents want to hear.
Sure.
They haven't yet realized that being pro-medical cannabis is now a majority position.
Right. It crosses a lot of boundaries that it didn't used to.
Sorry, I've gotten us way off. Into
No,
the-
you're
into the
good.
weeds
You're
here.
good. I
Into
just
the weeds, huh?
there's this one thing that just keeps
As the
really
weeds. You
that
said
really.
it, not me. It's a budding discussion.
That's
All right.
a good one. I like that.
I'll leave that one alone.
Oh,
Here we go. Here we go.
It'll never stop now.
For whom the bell bongs.
So,
Sorry, Laura, please.
no. I mean, I'm listening to everything, and I'm, that we're discussing, and all of our issues, and it seems unanimous that we're all in agreement on a lot of these things. And as a citizen of Pasco County, I've already, I believe in transparency and accountability, right? That's a big thing for me. And I have done a terrible job of paying attention to local politics over the 30 years that I've been here, because I never thought, well, we can't win here. So. And it's part of, and it wasn't even me. It wasn't that used to be what they thought. So I would always move. They would always, I would get shipped out to Pinellas or Hillsborough to win an election somewhere else, or
Right.
help win an election
Somewhere more
somewhere
winnable.
else. Right. I really feel like if in this moment in time, and I love the fact that we have this arena and that we're able to reach out to the public and people are sharing it. I want to use this platform not only to share ideas and to move our agenda with the electeds that we already have in place, but I think we need to reach out to people because, along with the good old boy system, and I have to go back to that because it's very real.
It is.
It's very real.
Or they would have engaged Zoe on the night of the city council meeting.
Exactly.
Yeah.
What are we going to do What are we going to do? We need, the people.
Until now, what have they done? They've operated with impunity, right?
Go on.
They've operated, you know, in their own little world. And in a funny way, we were talking about this, I think last night or maybe a few nights ago. In a funny way, Mr. Donald J. Trump has been a uniter. He's united us against him.
He's definitely making America
That's the one
great
good thing
again.
He's united us. He's united liberals, independents, libertarians of all sorts of stripes, of people across demographics and with different issues. He's united us against his whatever you want to call it. And I think now is a good time, what you're saying, we can harness something in places we didn't necessarily think. To what our esteemed host here was talking about earlier.
I forgot my name, that's why he called me esteemed.
Gregory,
Yeah.
Gregory,
Oh, hey,
Gregory,
there you go.
come on,
All right,
man.
All right, we're all right.
But, sorry, I keep hitting that microphone. But Greg was talking earlier about how, who would have thought such a gathering could have happened in West Pasco, that would be on CNN and MSNBC and not Fox News, and be, you know, have that sort of presence in a very Republican district, a place that won 20-30% for Donald Trump.
Bright red.
Bright red, as red as can be, as red as the hot sun. And the sun's actually a white star, so that's improper. But this is a time that we can harness a lot of energy that wasn't present before. And it's because of our good buddy D. Trump.
Well, yeah.
This Trumpster fire burns bright.
Long distance high five.
I have a friend who's somewhat politically active, and I respect the work that he does with the kids in our community, and that's great. And not long ago, we were sitting at lunch, and he says, "You know what they say about you?" Oh, they're saying things. We were talking about people in the political system in our county.
Okay.
And he said, "They say you're too liberal." And I was like, Jamie, I wear that shit like a badge, because our county commission is 100% Republican.
Mm-hmm.
That means that all of the policies that are not serving the homeless, not helping the poor, not helping minorities in our community, are generated by conservatives. If I'm too liberal, it's because there was an old story about Walt Whitman, who was an anti-war peace activist in the Civil War. And he, helped with the sick and the wounded after battles. And he toured battlefields, and he helped institute practices that saved lives.
Mm-hmm.
But he was, at the early part of the war, he was arrested several times for speaking publicly against the war.
Mm-hmm.
And there's a story about, I'm trying to remember, I want to say, I'm probably going to get who this was wrong. It seems to me that it was maybe Herman Melville went to visit him in a jail in Massachusetts when he was in jail. And he said, "What are you doing in there?" And Whitman said, "What are you doing out there?"
Right.
That there's a moment
Right.
when you have to actually speak. You have to stop waiting for other people to speak.
Right.
And you have to actually put your fortune, your safety, and your well-being on the line. And I don't want to be over dramatic about that, but we're under some threat here for speaking
We
up.
are.
Speaking truth to power is not a thing
That's right.
that is it almost never is comfortable or happy making.
Right.
I just want to say, I don't think you were being dramatic, and I hate to interrupt you.
No, please do.
And I want to share that
People will be shocked that you could get a word in edgewise.
2 weeks ago, a KKK recruitment flyer went around.
Yep.
Did you guys talk about that? Did you see it?
It's been ongoing. We've had that problem. I did a podcast about it in August
Did you?
in Shadow Ridge, right here in Hudson. There was they actually drove through the neighborhood in the middle of the night, and the flyer was inside a Ziploc baggie with a couple of small rocks to give them weight, so they could throw them up in people's yards.
Yeah, that's what
so
they did
distributed
again.
about 150 of them, and people. The way I got this story was a woman saw it happen, and she actually was so appalled and horrified. 5 o'clock in the morning, she drove through her neighborhood and collected them all up.
Good
She
job.
went to every yard in Shadow Ridge and collected them all, and then burned them. She only kept 2,
Right on.
and she sent
This
me a
is
picture
proof.
of one of them. Yeah,
That's
but
awesome.
yeah, I was like, oh, do you realize how dangerous what you just did was?
Good for her.
But yeah, so please continue.
No, I mean, I think that these are dangerous times. And I think they always have been. And I know that we are in the heart of it, right? We're in the middle of, there's a presence, and it hasn't been made by us for a long time.
Yes.
Right? And it's time that we break through that and we be the game changers.
Right.
And it's going to take a lot more than, conversations. This is great. We got to reach out to other people. I'm not, trying to, this is incredible, but we're going to need to come together. We're going to have meetings. We need to move in these critical times. We have the sense of urgency. People are upset. Folks are asking. They want to do stuff. We need to come together, and we need to, put together our strategy on what we're going to do to change this good old boy system.
Right.
Because without us coming together and moving as a force, it's going to stay the same. And I was just saying this to B this morning, I've lived here for 30-something years, and I need to pass this torch at some point, and I've been an activist, and I've been a leader of leaders for many, many years. And I can't retire without knowing that I made a difference where I live.
Right.
Yes, ma'am.
Right?
Right. Sure.
I need to know that I did good here.
Yep.
Right? That we left a mark, we changed, we did something to shift this, because if we don't do it, I don't know that anyone else ever will.
Right. I think we may miss. This may be the best opportunity of our lifetime.
Right on.
To have a positive effect in our local community,
That's right.
politically speaking.
And I can't come out and say that I'm a radical anything. I don't know where I belong right now. I feel completely displaced by every party.
Right.
All I know is what I know, and here and what I feel and what I believe in. So I'm not going to buy into any one thing.
As an angry, gun-toting, meat-eating Democrat, if you can radicalize me, it's you, not me.
I don't eat meat.
Yeah.
I am getting my gun permit. My husband said I have to, considering my level of, passion in this community.
And
He's
exposure.
concerned and he's concerned for my safety, which is fine. I don't know that I'd ever use it, but I think it's a good idea. So I'm going, and my son also. It's unanimous. My family's like, look,
Well, I hate that we have had to have that discussion, and my friends are far more exposed than I am.
Right.
I'm a middle-aged white guy. I
Right.
get a pass on scrutiny, at intersections, let alone
Yeah.
if I'm actually,
Well, I'm a
rabble-rousing,
middle-aged
right?
white woman.
You are
I
part
get the
of a
red
protected
carpet.
class,
Everybody
right?
just
Oh, yeah.
assumes. I mean, they're asking me to join clubs, and I'm like,
Yeah.
you should never read this book by its cover. You have no clue
Do you
who I
have
am.
this happen where people say outrageous things to you, thinking that because you're white and
All the
middle-aged,
time.
they want to high
course.
five
All
you
the
and fist bump
time.
you over?
course.
You're like, this happens to me with alarming regularity. And I had a guy tell me 2 stories last week that were so patently offensive, I wanted to punch him in the face. And he knew my dad. And what I think he never understood is that he's lucky my dad never punched him in the face, because that was what my dad would do. And he said horrifically offensive things about a local peace activist that I love. And then he said them further about, his motivation to punish someone for something they'd done wrong. And I'm like, I can't believe I have to have a rational conversation with this guy, and I don't get to hit him. It was unfortunate.
As a union organizer, sometimes I'll hear things like, someone will be in trouble, and I'll be having a conversation with someone that I work with, and I'm not saying where or whatever, but it's obviously in Pasco County and or Hernando County. It happens there also, and somewhere along the line they'll be like, he's not doing his work, or they're saying he's not doing his work. He's an older man. He's been here a long time, but he's black.
Oh.
And I'm like, and what's your point? Like, what are you saying? I can't. And they think
What does that mean?
What does that even mean?
Yeah.
Like, I have to. They expect me to relate to these things.
Yes.
And
yes.
I'm like, wow.
Yeah, I heard from somebody that
Wow.
volunteered at a food bank, at a food pantry, that said, well, the Spanish girls steal food.
The Spanish girls steal food.
Well, first of all, are they from Spain?
Yeah.
Is that is their language group is not their nationality? Secondly, why did you feel you had to tell me what their racial grouping was at all? Why is that at all relevant to them stealing from the food bank?
So how do we push back on that? What do we like?
I
Let's talk to our
confront
audience.
people. I
Let's-
say to them, what are you
Right, right.
talking about?
That's right.
Say it out loud.
That's right.
Say the Negro
Why would
has a
you
problem
say
showing
that?
up. If that's what you want me to
Right.
take from this, you need to say it. Be
Oh,
brave. I'm brave enough to call you a racist. Be
Yeah.
brave enough to be one.
Call
Can-
it
can
out.
I tell you-
Can I add one thing?
Sure.
Yes.
If you are hanging
That's
out
Corey
with,
Cottrell over here.
if
Hey,
you're
Corey.
hanging out with influential people that see that and say nothing, call them a coward to their face.
Yeah.
Amen.
That's
Because
difficult.
that's it's hard for people I love.
And
But at the
it
same
happened
time, like,
to you.
It's family,
it happens
right?
to me all
Well,
the
I
time.
mean, we had an
Yeah.
incident where you called someone a coward to their face, and
And that's the thing, like,
we burned a bridge there. But frankly,
you have to know better.
that person
Yes.
was busy insulting someone we know who is deeply
Yes.
vested in,
Right.
in her own fear and equality.
Right, and that's you can make all the excuses you want about that's not racism or whatever, but like there's a dictionary, and in the definition of dictionary racism
Yeah.
is that. So and that's the thing, like people, and I get the impetus, especially for people that are influential around here. They don't like to rock the boat, and that's the boat. right? So like asking them to suddenly change their entire lives, I get that that's a big ask,
Right.
but it's one that we have to ask.
Well,
I'm so glad I brought that up here. Thank you very much,
I
because
came
I'm
to
not
this-
afraid to kick up some dirt. I'm a shit starter all day long. You know, when it comes to stuff like this, excuse my language, but I have no tolerance for it.
It's the fucking internet. We're
You know, I call people out, you know, so I'm glad. Thank you. Do it and encourage others. You know, when you hear that, it's not okay. It's not okay. And if you allow it, you are a coward.
There you go.
Can I
Is
share an
this some guy
instance
named
of-
Steve Blofeld is watching?
That's my husband.
I know it is.
Can
Happy
I share an
Valentine's Day,
instance of
hon.
my own cowardice?
Sure, please
that
do, and then I want to
regret?
get some comments after that because we got
Okay,
some
sure,
people
sure,
chiming
sure.
in now.
So-
we've kicked the hornet's nest.
So one of the things I regret the most, and I kind of regret that I didn't resort to violence.
Me too.
But
Okay, Gandhi, slow your roll.
hey, Gandhi had his sour points too. But,
Yeah, that's true.
But so I was at work. I was at my place of employment that I work at now, and this was when the Obamacare rollout was coming out as smooth as ice when it first came out. And I might have been, I was talking a little smack to my buddy about it. I said, how could they, let this, they've been planning this, how could they let this website suck so much, They're letting the Republicans get on them now for a dumb website. They should have had it situated.
Yep.
So it appeared as though, from an outside perspective, like maybe I wasn't an Obama supporter. And
Here we
so
go.
a lady in front of me, we were standing in line at the Subway restaurant in the hospital, and she was in front of me, and she must have just caught a little of what I was saying, and so she turns to me and she goes, "Yeah, that." Oh man, I can
Say
say
it.
any.
Yes,
okay,
you
okay,
can.
okay. She said that nigger Muslim
Wow.
shouldn't even be president. And so I'd like to throw some excuses out there. Well, she was an old lady. I shouldn't have cussed her out. I was at work. I shouldn't have gotten into it on the clock. But those are irrelevant.
But he didn't get into it on the
I
clock,
didn't
just
get
for the
into
record.
it. Right, I didn't get into it on the clock.
It wasn't on the clock.
I
just
should
saying.
have. I should have. Who cares? Of course I wouldn't have struck her, although I wanted to. But I should have said something. I should have said, "Well, come on, get out of here with that." Even if all I did was put her down, nicely, something. I should have said something. And to this day, that irks me. And
Well, I come to this.
It's
I
not
come to
too
this
late.
this kind of thing from. I'm a certified batterer intervention program counselor, which means talking to men, specifically men's groups. I'm certified to do women's groups. There aren't many, interestingly, to address men who have physically abused their domestic partners, not necessarily women. Because now, with gay marriage, we did see some gay men who were sent to these classes. But my point is, the first and foremost thing that we have to do is confront them when they say things that are egregiously unfair.
right.
And
Or
so
indecent.
I'm in the habit of when people say horribly sexist things,
Right.
of reminding them that they're saying horribly sexist things.
Right.
And that's not a popular place to be. Like, I don't have a lot of guy friends. And the reason for that may be that they sense that I'm going to make it uncomfortable. And I'm not at all uncomfortable anymore making them uncomfortable about those things. And that's given me some courage to address the other thing. I'm not as authoritative when it comes to racial issues because I'm not part of a minority group, or
Right.
or I don't have a lot of contact even with minority groups, right? But having counseled dozens and dozens of victims of domestic violence, I had absolutely no problem confronting Joe Abuser with the nature of his level of discussion. When I think about the terms, when I would go around the room and ask them what's the worst thing they ever called their wife or their girlfriend, and all of the names were designed to reduce women to only their sexual function.
I see.
You can now start going in your head, go through
Right,
the list
right.
of horrible names that men call women,
Sure.
and think about that for a minute. That's dehumanizing. So I mean, that's
I
even
haven't
got me
thought
into
about
this
it like
bigger
that.
discussion
Sure.
about name calling in general.
Right.
Any name calling is dehumanizing.
Right.
And if I'm going to stay in the discussion with somebody and hope to bring them back into the fold of humanity, what I can't do is turn them into some sort of subhuman monsters or objects.
Right.
Right.
Those objects
Right.
were never in the discussion. So if I dehumanize you, now we can no longer talk as human beings, right? But comment-wise, I want to go back up. This
very
Steve Blofeld guy says she's hot. Must be
Stop.
about you.
My husband.
Must be about you, definitely not about me. Stevie Level says watching the rise of so many is difficult to ignore. I love you guys. Diego Garcia is a place in the Indian Ocean, but is also a guy in our feed who asks why downtown. I think he's going back to the dispensary issue. Simple, because that's where the sick people are. They're not in an industrial park. They live in the city. Furthermore, Zoe reminds us it's a cash business, and because it's a cash business, that makes the owners and the operators and the patients vulnerable to criminal activity. And if you're out in the middle of nowhere in an industrial park, there's no police presence there.
I see.
There's a police presence on Main Street,
Right.
and so everyone would be safer if that were the case. Barack says he wants in on this.
Right on.
Yeah, that's our friend Barack Alexander. I don't know if you know Barack or not, but
I didn't know
great
which
guy.
Barack. I was about to say, I miss you, Obama.
Well, about one time in 5, I want to say Barack Obama when I say Barack's name. Like he told me his name when I met him. I was like, for real? He was like, yep. That was pretty funny.
Name.
But he's Barack with a K, no C, like B-A-R-A-K.
Okay.
So he's a viewer. He's been on our show. He was on the news show, our inaugural news show. We had a great discussion about this very thing we're talking about, where we speak from a place of privilege, and he sees himself as privileged, even in the African American community. We had a really funny talk one night where I kept trying not to say black, and he finally said it's okay to say black. I was like, all right, well, so I want you to know if I say black, I have Barack Alexander's permission.
And I just want to add that this will not be our last discussion on that. This will not be my last discussion on this. So. I think we're in it together, so I know we're going to move this to a greater platform where we can involve more people.
Yeah, our friend Zoe, noted badass, says, "Oh my God, she's lucky it was you in that line and not me."
Yeah.
What do you got, Corey? Did I miss anything?
No, you guys are nailing it. I wanted to thank both of you guys for coming on, even though I had to go out and I'm trying to lock down.
Look at you with a shirt with buttons on it.
It's our pleasure.
Socks
Thank you for
and
having
things.
us.
on today. What?
Never seen this before. Who
I
are
almost
you?
went down there in my moose hat just to be like.
I have to tell you, I was
Rock
sorely
some
disappointed you
potato.
didn't leave me the moose hat today.
Oh, it might be in the truck.
Wow, that's okay. So
man.
anyway,
Do
you want to jump in over here? You want to?
Think this is perfect.
Okay.
Just shut up.
All right.
So once again, I just need everybody, I want to remind you, please put that call out. Tell your family and friends. We got to call Congress, 866-426-2631.
It's in the thread here if you scroll up.
Replace, don't repeal. That's the message. If you can say that, Happy Valentine's Day. Did you call Congress and tell them not to repeal the Affordable Care Act? Give them a hug. Did you call Congress? Call family. Have the conversations. Guys, that's the only way we're going to move our agenda. It's going to take all of us. It's going to take not only the 4 of us sitting here, but those of you out there watching, our family and friends. We're going to have to move this on a grander scale, guys. We got to push. We're being heard, but we need to make the change take place.
We need to make a meme on that. Seriously, you guys calling on the show was.
What we got to do.
It's not my first
day.
day, as my friend Corey
Right on.
Control would say.
Are you ready to call now? Because we can all call together. Does everybody have their phones out? I mean, who's going to call? Comment in the feed. Who's watching?
Oh, well, let's see. I know that Zoe has regularly been calling her elected officials.
Zoe, yeah, she's got a testimony.
Is a badass.
And
Let's
she's
see.
courageous.
Corey's not a voter. Are you?
What?
No, not a voter, not a citizen, right?
Not yet. Call anyway.
Yeah, no, I kind of. We have to figure out for sure if I can be a dual citizen, because I'm not going to lose my Canadian citizenship.
That's a good idea.
I think we have some attorneys right now working on this. Well, no, not right now. It was the election. But I'll see who I know what they could do.
So we'd like you to comment. We'd
If
like you
anything.
to right now commit to making a phone call today, Stevie Lovell.
Oh,
We'd
snap.
like you to comment, Barack Alexander. We'd like you to
Yes.
to commit to making a phone call today.
We would like you. We need you to do this.
Paige Ham Cohen.
Somebody has to make a shareable
Paige,
meme.
what's up, sis? Give Matt and the boys my love.
Somebody has to make a shareable meme with the the main.
She has it.
whatever, you
She
got
has
the
it.
phone
Yep.
number, all that kind of
Yeah, it's
Yep.
not a meme. It's a little Valentine's Day with the little hearts, candy hearts on it.
Susie McAnally, we'd love for you to call your local elected Eric John Canty. I'm gonna name names. Well, Ann Short put the phone number in the thread, so I'm pretty sure she's on it.
Cool.
Let's see who else.
Give us the names.
Come on,
McCarthy.
Florida. Let's
Give us
beat
the
New
names.
York on this
Stephanie,
thing.
Stephanie Linnea Bloveld
That's
is
my
watching.
baby girl.
There you go.
Hey, love.
So how old
Madre loves you.
Your child?
Yeah.
How old?
It's my oldest daughter. She's 24.
So she's heard harsh language before. It's okay that we swore.
Yeah, she'll be all right.
All right.
Are you all right, kitten?
My younger daughter taught my mom how to drop the F bomb. My mom would never in a million years say the F word, but now that she's been around my daughter,
They're always
a lot.
like, anytime I try to like get mad and say something, they're like, that didn't work. It doesn't work for you. It's just, I'm like, do sons of something, and they're like, no, it didn't work.
I got treated to my mom calling somebody a douchebag last year. Like, where did you get? So I learned it from Grace. I'm like, okay, yeah, that's fair enough.
You know, Corey just brought something up that came up at the town hall.
He does that.
Yeah, once in a while, I guess. But
all right. If you like that sort of thing.
he brought up in the at the town hall this discussion about people going to Canada for medical issues and vice versa. Bill Arrakis tried to bring up the fact, well, he made another preposterous claim. He said, we have the singular best healthcare system in the world. A common sort of
Statement of
right?
complete
A
fantasy.
statement of denial, yeah. And that was one of the few things that actually got me to start
here's the
shouting
thing.
like a crazy person.
He's right.
He's right.
He's right.
If you're rich,
Exactly.
you absolutely
Ah.
have the best care
So
imaginable.
if you're a one percenter like Gus Billirakis,
Like Bill Arrakis,
everything looks great from where you
everything
sit.
is fantastic.
Yeah.
From where
Should
you
we
sit.
ask Congress to try out the voucher system first? No, they haven't.
You test out those Medicaid block grants first and tell us how that goes. See how
If
far
it's so
that
wonderful,
gets
how come you guys don't use
Put
it?
them on.
What do you guys think about putting anybody who's in Congress has to have the same health care as the lowest common denominator and only gets minimum wage?
That's a sweet deal.
I think it's a great idea.
I think they should try. We did a thing
Because
called
the
Walk
only
a Day.
thing they're going to understand
Right.
is if it actually happens to them or
Right.
whatever.
Why would then? But then, why would
Wait.
people who are functional and wealthy be motivated to work? To work
It's
in
called a minimum wage challenge,
Public
and we've had some
Public
electeds take it. Remember the minimum wage challenge?
Yes.
We had people who wanted our endorsement, and they wanted us to get on doors and support
Right.
them. They wanted the union's endorsement. We had them do
Live on minimum
they
wage
and they
for
had
what?
to every day on Facebook tell you how their day went. By Wednesday, pretty much everybody was out of lunch money. Nobody
Yes.
had bus money to get home.
Having to prioritize
You
whether
know.
to get gas or buy lunch for your kids.
Right.
Yeah, Mike Fasano took it.
I
Amanda
remember
Murphy
that.
took
I
it.
remember that actually.
Yeah.
Yes, yes.
I had a flat
Yes.
tire, $80 for a new tire that I couldn't afford.
Here's something that I need to say today, and it is on topic. I want to commend Mike Fasano for yesterday speaking out publicly about Bill Aikens.
Did
He
he?
took them to task publicly on Twitter. He
Yep.
said, "How is it possible that that the Republican Party in this community thinks this is okay?" He did.
Mike's a good guy. Mike Fasano is a good man.
He
really is.
I have a long and
Republicans
complex
like that,
history with Mike Fasano, and he is an amazing
good
public
man.
servant, and
Yes, he
we're
is.
going to be we are so lucky to have him. Regardless
He
of
cares.
party principle, and he has aggravated people in his own party to a great extent in the last 8 years, and I'm very, very proud to know.
We support
Mike
our girl
Fasano.
Amanda Murphy for her
Yeah,
bids.
he handpicked her,
Wonderful.
and so moving into this election cycle, the idea that we've replaced a dedicated executive with an intern really aggravates me. Really
Intern, I thought you were going
aggravates
to
me.
say infant, but intern
No,
works
well,
too, I guess.
no,
That's
no.
not- come
But
on.
here's the funny thing: like I know young people who know her and know Amber Mariano to be a really great person and a well-meaning person, and that's cool. But
Sure.
we replaced a a seasoned legislator with an intern,
I didn't think
so
it was
we're going to
gonna
lose ground.
happen.
We're going to lose ground.
I was very shocked. I really didn't think that she was an opponent.
Well, I want to
didn't
give her
think-
daylight to
Yeah, we've made that
to show us.
error a couple of times in the last season.
Yeah.
I didn't though. I didn't with this past presidential election.
Yeah.
Folks were like, "Why are you stressing? Why are you canvassing
Yeah.
for 16 hours a day? Why are you driving
Right.
to St. Pete? Why are you doing?" For the last 4 days, that's all I did. Was try to get people to vote in St. Pete, and they were like, "Don't worry about it. Don't worry about it." I'm like, "I'm worried." I'm worried. People that I knocked on their door, they're like, I'm sick and tired of you guys knocking on my door, and I'm not going to go vote because you've been here. You guys have been here so many times. He's not going to win. It's not going to happen. I feel like driving back there. I really do.
With
Speaking of people you want to punch in the
thank you
face.
for hashtag Trump's America.
Well,
Yeah.
the day after, I spent an hour out here curled up in a fetal position on the dock, sobbing.
Oh, I was in rough shape.
But by the time we got to 2 days out, what Corey and I landed on was I didn't do enough.
Sure.
I
absolutely.
personally, I didn't have a Hillary sign in my yard. I didn't have a Hillary.
I did
sticker on my
everything I
car.
possibly could.
I know.
And then some. And you know what? I'm dragging all of you in with me.
Yeah, okay.
Next time
Well,
around, I'm not going
listen,
alone.
I
And you're going to be
promise you.
mad at me, but I'm going to be here at the morning, knocking on your door like, look, we got to be somewhere by 8 a.m. And I know you're not happy, but get your shoes on.
So
let's
what's
go.
the next big fight?
I think
that
we
can
all
can
owe
help
you.
with?
Everyone watching this right now who is like, oh no, Trump. Blah, blah, blah." we all owe you 110% commitment right now,
Okay.
Yes, we do.
and not to be followers of you, but to be fucking leaders bringing another 100.
Amen.
Yep.
Amen.
What's the next big fight that you think will have a positive impact on? our
Local election.
Local
I think we need to get started on local
Right.
elections. I think we need to move some chairs around.
I made an interesting observation. I was just talking about the conservative nature of our county commission, and I went through and I looked at the makeup of all. There's the county commission, Port Richey City Council, Newport Richey City Council, Dade City, which I think is a city commission, and Zephyr Hills. Okay, there's one person of color in that entire set of elected officials, and I think 6 women out of
Who is it?
25 people. If you count them all up,
Yeah.
all of our elected officials in Pasco County, you know, at the people that make our weekly decisions
Right.
on our lives here in Pasco County,
Right.
they are overwhelmingly conservative, overwhelmingly white men.
Right.
And there's one woman of color on the Dade City Commission. I can't remember her name. I apologize. I don't get to Dade City very often to participate. But the point is, you know, if African Americans are
it's very
10% of our population in
representative of
Pasco
our-
County, they should be 10% of our elected officials.
Absolutely.
It's going to take a minute for us
Absolutely.
to find those that
Half
wanna
of our
run.
officials should be
Yeah,
women.
yeah.
Right?
We need more women in there as well.
Right.
I just think it's going to take a minute because I've been looking around for people
Well-
that are interested in running, and you know, it's going to be something that we all have to do. We have to talk to each other and find out, you know, who do we know that, you know, really wants to help make a difference in where we live, you know, in our community, not build bike trails, you know, way south of here, but who's going to help us? Who's going to help us? That's a dig. It is, because we didn't need a bike trail. We needed help for our homeless veterans, right? We needed help for our homeless and our hungry here. We need nutritional food in our schools to feed the kids that their parents are out working 2 jobs and still can't buy groceries.
We need to be saving Hudson Elementary School
You know
from
what I'm
being closed.
saying? Like we have work to do
That's a
right
start.
here. You know, so
That's
we
a
need to find
start.
somebody from here that's knowledgeable enough, you know, that's willing, that wants to do it, and then we can help them, you know, get in there. And we have to find a lot of people. We have to find, we need to change this climate. This is not working for us
Right.
anymore. It's
not.
just not. It's not working. When I say us, I speak, you know, for me and the folks that, you know, I represent. And some of them don't even realize that these politics aren't working for them. And they're still busy blaming the Democrats for what their life situation is, you know. And I'm just, they need to stop. We need to stop looking at these parties. We need to take the labels off,
Right.
and we need to start addressing the issues head on, and making some changes here that we feel, that we see.
And, you know, we have something of an advantage on our side because we're part of the labor movement.
Right.
So the people that we talk to have a vested financial interest in some of the things that we have to say. The harder part is, you know, we have a lot of enemies. You can go all the way up, Trump, whatever. You could go down the line. Our commissioners, this and that. History's against
governor.
us. Our governor's against us. But you have to add on that list apathy, you know, and people's
Right.
misunderstanding and people's just general approach to politics, not just in this, you know, nationally, but locally. And so that's something we have to peel off these other industries, these other constituencies. Like I said, we have a bit of an advantage because we can directly affect people's pockets. We can say, these policies help you and your family on these issues. We can directly, how do you connect with somebody walking down the street? How do you connect with somebody who you don't have that specific
It's
and
a little bit
direct
easier
interest in?
than it is in our network, believe it or not.
Right,
Right.
sure.
Because folks that are in the, you know, that are part of this are like, oh, I don't know what and then folks on the outside hear what's going on the inside, and they're like, oh man, what I wouldn't give to have those rights, what I wouldn't give to have somebody fighting for me, what I wouldn't give to be a part of that. You know what I mean? So we can do this.
I'm so proud to have you guys here today. This is the kind of guest that. What have you been doing, you slacker? You should bring this shit every day. What's going on?
No, it's wonderful. Thank you for giving us the opportunity, and I think we're getting close to that time. We have something I'd like to discuss, if you don't mind.
Oh, I totally mind this bullshit.
No, because we need to
No,
move.
do it.
We need to move forward.
Yep.
And I think that we need to take this discussion to a larger place. Yeah, I love this. I mean, coffee on the dock. You might wake up tomorrow morning at 6 and I'll be out here with my coffee by myself.
Entirely acceptable.
I have my fishing rod on
It's
the
so
back porch.
relaxing. I love it.
Yep.
But I think we need to get to like a public place, maybe a park or something, and we need to invite, you know, our viewers and our neighbors, and we need to bring
What's wrong with
everybody
Mr.
together.
Bilarakis' next town hall meeting?
I think we need to do it together, without him there, and absolutely, you know, we're going to move there, right?
Friday.
I mean, I got some stuff. I'll be.
Okay. Yeah. Let's.
I want
book
to
it
be
in.
there if you can.
No,
If we
no.
can,
let's-
I'd like to
no,
be there.
I want you to be there.
Okay, thank you. I don't know where I am. I know I'm in St. Augustine, I'm in Miami, and then I'm in New York.
Slacker.
So, yeah. So
What do you do with
Fort
your spare
Myers, I
time?
think. Thursday. This is my spare time. No, just kidding. So I have, this is important, and I'd like to, get together with you guys and just kind of talk about some like-minded folks that we know, and let's put together a quick agenda, and then we can pitch it to the viewers and see who wants to come and buy in, or
Yeah, there will be lots. I mean, one of the things I want to, as far as organizationally, something that we're working on and have noticed. Greg's been running shotgun on the homelessness issue as far as
right.
our
Right.
little sort of
That's still going.
group,
That's
right,
still
right.
moving. I'm still
so we're
there.
doing
Steve's there.
We're doing the pit count. We're starting to get a bit of an army built up for that.
Now he might be interested in that. I haven't had a chance to talk to him yet. I didn't mean to interrupt you, but
No.
talk to us about
that's
the
the
pit
whole
count before we're done.
Yeah, I mean, and the main thing is just to start organizing people.
Right.
And it's people that, we have no idea if they're Republicans or Democrats or whatever. We
It's
don't
not
care.
even
We don't
important.
care.
really care.
Right.
Right? And it speaks to your point. Like, let's find some things around here that, we have a lot of passionate people that agree on this thing, and then just get to work.
Yes.
Right? And then we don't really work
Let's
about
focus
like,
on the issues and not
right,
the
yeah,
parties.
The red flag, blue flag, screw all that shit.
Right.
Let's just actually get some stuff done.
Yeah, I mean, we're
And
neighbors.
through
We
that,
live together.
We build awesome relationships, and we start building a coalition. That way.
Yes.
Right.
Yes. Here.
I want to hit this number one more time. 866-426-2631. You saw what it takes. It takes 2 minutes. You call up, you enter your zip code, it connects you to either your senator or your congressman's
It's a sweet
office.
line. It can be
and you
any
can
more
leave your
convenient.
opinion, and it says right there what you should say. Tell them that you are not in favor of them repealing the ACA. That's what this number is for. So please make that call today, Valentine's Day. Show where your heart is.
Help us
Morning.
find little Marco. Help us find little Marco.
Where's Marco?
He's lost.
What's up?
Zoe's loud calling right now.
Right on. Go Zoe.
Today, that's the way. We love her.
I'm gonna call too if you don't mind. I haven't made my call.
Do
yet
it.
today.
Let's do it. Yeah, we're still on, by the way. We're just still going here. So.
Yeah, there's no rules.
So you can call every day?
We're moving today as a day of action.
Okay.
And then what we do is we take a count on how many people called through this number.
Nice.
So we can keep a tally on Florida and how many of us are doing this thing.
Right.
We want to win here.
Help us
So
find little
while
Marco.
you're getting ready to make your call, the pit count is supposed to be an annual count, a census of the homeless in our community that is designed. All federal funding for homelessness comes from HUD, and it is all based on having an accurate census of the homeless. It's called a point-in-time count. It's
I'm
supposed to
gonna excuse
happen
myself and make the call.
minimum every 2 years. Make sure you stay on the middle of the
Microphone.
Whoa.
Microphone, Loretta. You're wearing it. There you go. You want to leave that here.
Good catch.
All right.
It's not our first day.
Yeah.
And
So I
Sure.
met with Rain Johns, the Homeless Coalition Director in Pasco County. I actually went there prepared for a fight because
Really?
I didn't think that I couldn't get anybody to tell me how many homeless there were.
right.
And that's because the last executive director of the Homeless Coalition botched the count badly
Oh.
twice in a row. So we haven't for 5 years known accurately how many homeless there are in the community. And so I went there looking for a fight, and it turns out she's the new director. And I asked her, okay, since you can't tell me how many homeless there are, since you can't tell me, have we impacted the number at all? What's one thing my listeners can do to help? And she said, get me 100 volunteers for the pit count. Ha 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 ha! She laughed.
Oh
So
my God.
I got her 55 so far. We're working on 100.
Hey,
We got
that's
another
not
week to
bad.
go. So we're gonna comb the woods, the shelters, the places where the homeless live.
Right.
Looking for the places ragged people go, as Paul Simon
Right.
would write in the song "The Boxer." And we're gonna try and have a positive impact by getting an accurate number, so we can base our service level and our funding level on knowing what the problem is. You can't get there if you don't have a map.
I know for a fact that Pasco Hernando State College, PHSC, through their Human Services Student Organization, is also trying to participate and attract
Beautiful.
volunteers. So if you want some more information on how to get involved through that institution, just Google PHSC,
Right.
and they'll hook you up with the right people.
And I would urge anybody that is hearing this for the first time, and I don't think there's anybody left in the world that I haven't said this to personally, if you would like to participate in the pit count, if you would like to participate in logistics support for the pit count, contact me, 859-8537, or of course you can find me on Facebook. I'm obviously not hard to find because I wear loud shirts most of the time. And if you can't get me, contact the Coalition for the Homeless directly in Newport Richey. Rain Johns is the director's name. You don't need to talk to her. You tell them that you're there for the pit count, and they will put your ass to work. And we'd really like for you to go and do that. So that's my that's my thing that I try to mention every single time. Make sure you stay on the nails.
Yes, sir.
You're fine.
Stay on the
Come on
nails,
in.
Yeah.
lady.
Come on in.
Bring it in.
What else? We want to wrap this up? We got
Just don't step through that hole. I would be very
I
sad.
say just one more thing.
No.
One more thing.
Absolutely
You
not.
can say 10 more things.
10
I don't
more
give a shit.
One more thing
we don't have a
about
clock, so
about
I'm not
So,
afraid of dogs. I've had many boats. I'm good.
All right.
when we
Don't interrupt the camera.
No, you're good.
let's call a spade a spade.
You go on,
When
dude.
they talk about
Excuse me,
you know,
guys.
repealing and replacing, ultimately, what they're going to end up doing is what? They're going to end up simply tailoring Obamacare. We hope, I
what we
presume,
want, yeah.
that that's what's going to happen. That they're ultimately going to feel enough blowback that they're just going to tailor and try and
Make it
tweak
more affordable.
Make it. We'll see. Well, I don't know if they'll
Expand
try to
Medicaid
make it more
in
affordable.
Florida. Hello.
well, that's going to require a different governor.
Which situation
Right,
makes single
that would.
payer eventually more likely?
What situation?
Because it's not fixing Obamacare.
Medicare for all.
What is the lever that's going to force government to do that thing? And
What is
fixing
the lever?
Obamacare, which is effectively
How
a
do we
handout to
leverage that?
insurance
How do we
companies.
make that happen?
That's the
What
thing.
would we
Like
do
what
to
I'm
do
saying is, I honestly I would like that in the near term because I want to make sure everyone is taken care of. Right. That's sort of the having
think-
people that are uninsured is like a nightmare that I don't think people really understand. Or
I like
connect with.
that thought, and I think that we should tease that out and
Right.
definitely make that because it's going to be on the people. That's how we're going to,
Right. We
strong
have to
on them
demand
and make
it.
that. Yeah, we're going to have to demand it. We're going to have to demand it publicly. We're going to have to demand
Right.
it loud and large.
But I have to tell you, I'm going to butt in for a minute and say I think we have a generation of legislators at the county and state and even federal level that are really used to doing whatever the fuck they want without regard to what the people say.
Right.
Because
That's
we're
over
experiencing
now.
that right now.
It's over now.
Well, I hope.
No, I mean it is. We have to. I mean the lever is getting.
The more
pressed
I think
now,
about them
right?
being threatened by me telling them we would unelect them if they didn't support what we want,
That-
the
yeah,
better
they're-
I get about that. Like, what are you talking about?
They're-
That's that's the contract.
Welcome to
you
democracy.
serve, I vote. Bye. You're out of
Right,
here.
right.
You'd be mad at your boss for saying they can fire you.
Right,
Well, they can still
precisely.
fire you.
We have to
So-
show up in Tallahassee and DC.
Yeah.
We have, and if we can't do that, or if you're not able to, we have to show up at their home offices, and that's happening, right? But that's what we have to do. We have to hold them accountable. We have to show them that we're here and that it's real. We have to leaflet the communities. We have to involve the medical field. We have to talk to doctors. We have to talk to patients. We have to talk to. We need to step outside once again, outside of our comfort zone, and this needs to be a conversation that you have in restaurants over breakfast, which I know you guys do a great job with. You know. But I mean, all of us need to be doing this. We need to
Right.
talk about it because that's what's going to make other people more comfortable with the idea.
So let's make a deal right here today. There are two people here involved in new media where like we just turn it on. You know, that's what Corey got me doing is getting used to the idea that it doesn't have to have all sorts of formality and process in it. We can just turn it on and talk directly to people. Okay, so let's make a deal right here that we will do that, but we need you to send us people that want to carry that message.
Yeah, we
need-
should
you
be
know,
interviewing somebody
know
like
who
you guys
the
every day.
doctors are. You know who the
Right.
speech pathologists are. You know who the people that serve our community in that way are. You let's make a deal. You call me and say, hey, I got somebody who wants to join you on Tuesday morning. They're on. So
I have
please,
it already.
So please, let's.
I
Yeah.
mean, it's
Game
not.
on.
Yeah, let's do it.
All right.
Let's do it. But what can we do to maximize viewer?
You can absolutely reshare this. You could encourage people to financially support what we're doing. That is a problem for us. We boost posts to get more viewers. We actually pay for more exposure on Facebook.
You do?
Yes, we do, and we want to do that on YouTube and on all the other social media avenues that we have. There's an underwriting cost for that.
Are you guys one pool? One resource
Call
pool?
it Baboon Room Media Group for now. Yeah, because I think supporting Corey supports me because I do editing work for Corey and co-hosting work for Corey. So
Well,
I
and
think
there's a budding network in the works. That
frankly,
sort of,
we don't know what the hell we're doing.
Yeah.
Could I get you guys
We're making
to
it up.
come to a meeting maybe in Tampa?
Sure.
Yeah.
Okay.
Yeah. You need to just let us know when.
Yeah.
I have some.
I'll even
transport
wear shoes for that.
limitations, But
Wow, really? You
Yeah.
won't come in barefoot?
I
you
mean,
may wear the moose hat. It's a thing.
I should
Come as you are, Corey. Anytime.
Oh, man.
I sometimes have transport limitations, but if you invite us, we'll figure
we
out.
can
how to-
solve all that.
Yeah, that's not an issue.
These are just
It's not an issue.
fun details.
Yeah, we just
want to
have
thank
to-
everybody really quick. Sorry
Go ahead.
for sharing. There's like 13, 14 shares so
Nice,
far, which is awesome. Thank you.
John Redding, thank you. Keep rocking. I don't know who John Redding is, but
Bye, guys.
one of your guys. John Redding.
John,
Oh, Rando. We got a Rando viewer. Nice. Thanks, John. Thanks for joining us. Tune in every day.
oh, man.
All right. Good talk.
Appreciate you, listeners.
I think you
Thanks, guys.
somebody's got
I
it.
will. I just, man, you guys
Basking in
you
it?
guys kicked the
Let's
shit
just,
out of this
hey, let's
today.
just do what
Are
we
we
do.
done?
Ready? Watch. Wait. No, we're gonna show you what we love to do.
We're
is
doing this thing. Oh yeah.
Oh, yeah, I see that. I'm like, what?
All right,
Like
hold
hamming it up.
on.
Sometimes we just
do like a little coffee cheers.
just
and then nothing.
Picture of this.
That is delicious and cold.
now you know why we do coffee on the dock
Be.
and not coffee in a stuffy, quiet room.
Fair enough.
Yeah, I'm
Fair
big.
enough.
Because most days this is
good
just
for
beautiful.
you.
out here.
No, guys. This is right on. Thank you.
All right.
You know I have a boat, right?
I do not have a boat.
I do.
Okay.
It's a little one, kind of like the one that just
I
came
love
through
boats,
here.
yeah.
I'm not on it, am I?
They can probably hear you.
All right, I'll turn this up.
All right.
Besides which, I want to share a story with you guys about my prime minister that is
Mr. Trudeau?
it's way less constructive than your conversation. So
Okay.
you guys don't get
Thanks,
to
everybody.
hear it.